Hi, Home Health Aides. Nurse Naomi here. I'd like to take a moment to explain to you how to properly put on, take off, and reuse your face mask if necessary. As you know, there's a really serious shortage of face masks, so reusing your mask is going to be a very useful thing, and knowing how to do it properly is going to be even more important. So when you arrive at your client's home, as everyone is already doing, the first thing we're going to do is wash our hands. We're going to be following very strict infection control protocol and procedures, and we're also going to be washing our hands and washing our clients' hands very frequently throughout the day. So I've already washed my hands. You will all be receiving a small little PPE kit. You will have a hand sanitizer. You will have some printed instructions to reference. You'll have a brown paper bag with your name on it. And you will have one face mask, one surgical face mask. You can discard of the Ziploc bag once you've taken out all of your supplies. The hand sanitizer you should keep handy with you so that before you take out and put on your mask, you can use this to sanitize your hands. So we're going to learn how to properly put on a face mask. Obviously, perform hand hygiene. You will grab your mask by the ear loops. Now notice that there's two sides to every mask. Usually, the colored or printed side of the mask is the part that goes outside. The part that's white is usually the part that goes inside towards your face. We'll make sure to let you know, based on the mask that we provide you, which side is outside, which side is inside, and you can always call us if you have a question. There's also a part, the top part of the mask, which has the metal piece. That's the part that's going to go over your nose. So make sure that your mask, before you put it on, is the right way. You'll take your mask, grabbing it by the ear loops, place it over the bridge of your nose, pull it over and around your ears, and then you're going to grab the bottom of the mask and pull it down and around your chin. Clean hands, clean mask. With 2 fingers and 2 hands, you're going to push down on the metal around your nose to make sure it forms a nice tight seal. Now you're going to go perform hand hygiene and put gloves on if necessary so you can go and care for your client. You will keep this mask on throughout the duration of your shift. During your shift, you should not touch your mask, scratch your face with it, touch your eyes. You shouldn't pull the mask down over your nose. You shouldn't remove it from your ear and walk around like this. The purpose of this mask is to protect you and to protect the client. So we're going to keep the mask on properly at all times throughout the shift until it is time for you to remove the mask at the end of your shift, or if you need to eat or drink. To properly remove the mask and reuse the mask, these are the techniques that we're going to use. So perform hand hygiene. Have the brown paper bag that we provided to you open and ready. You're going to, with gloves on, you're going to remove the mask by the ear loops, keeping the inside part. Don't touch the inside part of the mask. That's the clean part. Folding it together, okay? You can pinch the top with your gloves, and you're going to place it inside of your brown bag with the strings facing the opening of the bag so you can grab it easily later. And then you can press down on the mask to keep it folded in half, and then fold your bag. Remove your gloves, wash your hands, drink, eat your lunch, whatever you have to do. Now you're going to come back and reuse your mask. Wash your hands, put on gloves. We're going to open our bag and get, by the string, our mask. Again, paying attention to which side is up, which side is down, not touching the outside of the mask, only holding it by the ear strings. We're going to place it over the bridge of our nose, pull it down around our chin, up and over our ears, and then with gloves on, press and hold, or press down to shape and mold the mask to your face to make sure it's securely put on again. Remove your gloves, wash your hands, and then now you're ready to go back to work with your client and put on a fresh set of gloves if you're going to be directly caring for the client. This technique can be utilized up to 1 week. You can reuse this face mask for up to 1 week as long as it is not visibly soiled, wet, or very, dirty. Please make sure you reach out to us if you have any questions in particular about the proper use of this mask. Thank you, everyone. Stay healthy.